their health status and the work they do, respectively. I want to reiterate our call to our people, particularly those who have not been vaccinated, to turn up and get vaccinated now that we are having more vaccines. Again, I would like to repeat, we make this call to all Kenyans. Please do come out, get vaccinated. We have the doses now. We shall do all that is possible to make sure that they are available throughout the country. Go out and get vaccinated. It is when we are vaccinated and a large number of Kenyans are vaccinated that we can have some level of comfort that we are managing the virus well. This will allow us to be able to consider relaxing some of the protocols that we have put in place. In the same breath, we appeal to those who took their first dose and are due for the second dose, but have not turned up for it, to please do so. It is important to remember that although the first dose provides one with some level of immunity and protection, full protection only comes when one is fully vaccinated as per the protocol of that particular vaccine. Remember, for us to fully reopen our economy, we need to have achieved herd immunity or have our entire adult population fully vaccinated. The government is doing its part to acquire vaccines, deploy them, distribute them, deliver them to Kenyans in Kenyan arms, and on their part, Kenyans should avail themselves so that they are fully vaccinated as soon as possible. We want to reiterate that all vaccines deployed in Kenya have been approved by the World Health Organization, and that no vaccine is superior to the other when it comes to prevention of severe corona disease and prevention of death. Therefore, we urge all Kenyans, when going out for vaccination, that we shall not be emphasizing on the brand names, but rather ensuring that every eligible Kenyan gets vaccinated against COVID-19. With the donations that we have received, we now actually have 3 types of vaccines that we are delivering in the country. The AstraZeneca vaccine, we have the Moderna vaccine, and we have Johnson & Johnson vaccine. We also expect very soon to add onto this repertoire the Pfizer vaccine that we're anticipating, again, as a donation from the US government. So the point we are making here is that there will be a variety of vaccine types available for Kenyans. And Kenyans, please do take whatever vaccine is available at the site that you go to get vaccinated. They are all equally good in protecting you from particularly severe disease, coronavirus disease. So let's not try to be very selective. Let us take what is available and get vaccinated. Once again, we want to appeal to our county governments to support the national government efforts by mobilizing communities to get vaccinated. If we can get everyone vaccinated, then our country will be safe and we shall be able to resume normal business. Remember, no one is safe until all of us are safe and have been vaccinated against this deadly virus. As I conclude, I once again wish to most sincerely thank the government and the people of the United States for this generous contribution to our vaccination efforts. And we also look forward to the further donations that we are anticipating from the US government and also from other well-wishers. I thank you very much and stay safe. I would now like to invite the representative of the US Ambassador to Kenya, Dr. Mark Guterres, who is also the CDC country director, to come up to the podium and make his remarks.
Ladies and gentlemen, good morning. Thank you, Mheshimiwa Dr. Rashid Aman, the Chief Administrative Secretary of the Ministry of Health of Kenya. And thank you to our Covax partners, the Gavi, the World Health Organization, UNICEF. We thank you all for bringing this US donation of the Moderna COVID-19 vaccine to Kenya. This shipment contains the second consignment of 880,000 Moderna doses, bringing the total donation to 1.76 million Moderna vaccine doses. This donation is part of the Biden-Harris administration's commitment to help combat COVID-19 around the globe. And it is based on the strong partnership that the United States and Kenya have built over the last 60 years. The US government is pleased to be part of the coordinated global effort to bring life-saving vaccines to the people of Kenya. These are the same safe and effective Moderna vaccines that have been used to vaccinate tens of millions of people in the United States. Our two governments have worked together on a variety of fronts to curb COVID-19 in Kenya. These life-saving vaccines will fill an important need at a critical time in Kenya's fight against COVID-19. This vaccine builds on the support already committed by the United States to support Kenya's COVID-19 response through lab testing, supplies and equipment, training for health workers and other frontline responders, public health messaging and research. These Moderna vaccines join the other vaccines that have been delivered under Covax that are available in Kenya. We urge everyone to get vaccinated with these Covax-delivered vaccines. To those still deciding whether to get vaccinated, please make plans to take the vaccine. With the Delta variant circulating widely in Kenya, it's all of our responsibility to protect ourselves, protect our families and our communities from this deadly disease. The Covax-delivered vaccines are safe, effective, and becoming more available across the country. Please do not let rumors or misinformation dissuade you from getting vaccinated. You should seek out sources of credible information, like the Kenya Ministry of Health, the WHO, UNICEF, USAID, and my organization, the US Centers for Disease Control. The US government will continue to work with the government of Kenya to bring additional life-saving vaccines to Kenya through the Covax, and will continue to do all we can to build a world that is safer and more secure against the threat of infectious diseases. Asanteni sana. Thank you all.
Let me now invite the representative of the country rep for UNICEF, Dr. Yaron Wallman.
All right, and those are images from the JKIA International Airport, whereby officials from the Ministry of Health and the U.S. mission in Kenya have received